Hey, it's Dr. Frank from Integrative Dry Needling doing another clinically relevant video for you. This one's interesting and it kind of plays off the one that Dave Griswold from IDN did about lateral epicondylgia. This one's looking at a deeper kind of dive into the radial nerve involvement when we see these persistent, in particular, persistent lateral epicondylgias. This was a study that was done, and they did it kind of interestingly because they were looking at cross-sectional area compared to hypersensitivity of the peripheral nerve itself. And the way they were able to kind of look at this is they did basically algometry, right? So they did a spiral groove assessment. They looked at the arcata fros, which many of you know is the area where the deep radial nerve pierces through the supinator. There's an entrapment point there called the arcata fros. And then he also looked at the anatomical snuff box, right, where the superficial radial nerve goes. So they were looking at pressure pain thresholds in these particular people. The other thing they did was looking at diagnostic ultrasound, and they were looking at the cross sectional area of the nerve. Now, they did that again at the spiral groove and looking at the antecubital fossa. Now, what's significant about this is the people that had lateral epicondylgia had an increased cross-sectional area of the radial nerve. Now, an increased cross-sectional area means nerve inflammation, nerve edema, as you go through that. And it was certainly worse on the affected side compared to the unaffected side. And the greater the cross-sectional area, the lower the pressure pain threshold. Obviously, it hurt more, right? And then the other piece that they put together was that the greater the cross-sectional area, nerve swelling, the more the disability that they had with the dysfunction, and that was measured on that tennis elbow scale, the functional scale that they use, right? So now to kind of put that together in their conclusions was that when you have this pressure pain hyperalgesia and you have nerve swelling, then they believe that it's this hyperalgesia that actually is the peripheral driver of the lateral epicondylitis, and more importantly, may even be the maintenance of the actual pain itself. So the pain can be living within and around the nerve itself, not so much necessarily around the actual soft tissue or the tendon and things that are around there. So I think that's fairly interesting. And this was also one that reminded me of an article that came out. This one came out in 2015 and was really looking at tendinopathies from shoulders to elbows to knees. And essentially, they said it appears likely that the association between persistent tendon pain, tendinopathy, and the nervous system sensitization. So those two things kind of came together. So if you have somebody that's coming to you and they have persistent lateral elbow pain, and you're doing a standard treatment, usually locally, many times, of strengthening and stretching, which are fine, right? Kinesiotaping, looking at the bandits and bandits and bracing types of stuff, as well as local needling, and you're not getting the results that you're hoping for, then we've got to look at this on a different scale. We got to look at it a little bit differently. So the clinical relevance of this truly is based on the study, if you can actually reproduce the complaints of pain with mechanical provocation in and around the neural structures, then you should probably apply treatments to those neural structures. And the key here is it can't just be necessarily a local kind of application, right? So it's not about necessarily local treatment, which at times can be helpful and useful, but it's really about looking at the entire distribution of the nerve and being able to treat the nerve where the pain is perceived to be and also where the pain could be. Because again, if you have a problem in a nerve in a place, you potentially have a problem in a nerve in the entire nerve distribution. So we've got to look at this on a higher scale. So hope this gave you a little bit of a look-see at this. It was a good article to read, and it's certainly something that we talk about in our courses is looking at things more systemically. Have a great day.